Welcome to Heart Failure Unfiltered. My name is Nick Hartshorne-Evans and I'm the founder and CEO of the Pumping Marvellous Foundation, the UK's heart failure charity. Today, we will be discussing when primary care gets it, why knowledge changes everything, and this is all related to our Marvellous Masterclass programme of events in the northwest of England. And this is a podcast about heart failure and why the simplest ideas often save the most lives. This podcast asks one question over and over again: what happens when primary care gets it? Because if care isn't adopted, it doesn't matter how clever it is. Today isn't about policy. It isn't about targets. It's about something much simpler. It's about what happens when the person sitting across from you, your GP, your nurse, truly understands heart failure. Because when they get it, everything changes. The speed of diagnosis, the way they talk to you, the confidence in the room, and sometimes the trajectory of your life. This morning, we are at the Liverpool Podcast Studios. That's a surprise because we're always here. And I've got some amazing people. I've got a couple of our patient educators and I've got a GP with us as well who's extremely knowledgeable. Right, so introduce yourselves.
Hello, I'm Corinne Hudson. I'm a patient educator with Pumping Marvellous. I've been diagnosed with heart failure about 4 or 5 years ago.
And you're the
I'm
deputy chair of the trustee board.
I am the deputy chair of the trustee board, which bit I would miss out.
Gavin Redhead. I'm a patient educator with the Pumping Marvellous Foundation. I'm somebody that was diagnosed with heart failure, and I've been right through from diagnosis through. I'm now post-heart transplant.
So you've had it all.
Yeah, I've been through all the levels, so I can talk about everything that is involved with heart failure, through from initial diagnosis through advanced into heart transplant and beyond.
And we've got Sue.
Hi, Sue Kemsley, GP, 30 years, working in Cheshire, primary care clinical cardiology lead for the North West Coast Cardiac Network and clinical CVD lead for Health Innovation North West Coast.
So we've got a really esteemed network of individuals here. And this is a very patient-focused podcast. And it's about talking about the moment of not knowing. And so the question, who are we going to ask first? Gavin, when you first went to your GP with symptoms, so you know what the symptoms are of heart failure, how did that consultation feel to you?
The first time I turned up at the I had a cough for about 6 months, and that was the thing. And I didn't realise at that stage that it was heart failure. I just thought I had a cough, and this was pre-COVID, so it was nothing COVID related. And following nagging from my wife, I turned up at the GP. So couldn't get in to see my normal GP, so I saw another doctor or a clinician. And initially, it was felt that it might be asthma related. So I was given an inhaler to take and went away. And then when I did get back to see my regular GP, he's a GP with special interest in cardiology, and he recognised, he knew my history, he knew that I'd lived with heart issues all my life, and he recognised what might be going on and suggested there might be something further happening with the hypertrophic cardiomyopathy, which I was suffering with at that time, and started me with a range of tests. And it creates... It doesn't matter, any sort of deepening of signs and symptoms that you get creates anxiety within you. You're not sure what it is.
And what was the impact of that anxiety on you?
It adds to the burden of the actual feeling that the signs and symptoms that you've got. It deepens, it worsens those symptoms almost, because it has an effect. So if you're already struggling to breathe, you're struggling to sleep at night, those symptoms only get worse because of the anxiety. Mm-hmm. So then you're in this issue. Is it the anxiety that's making me not sleep? Is it the condition? Is it the breathlessness, the coughing? What is it? And it starts to impact on your work. I mean, I had quite a senior position within local authority, and you're starting to focus on yourself when you really need to be focusing on work.
So what was it like for you, Corinne? Same sort of questions.
Yeah, you start to, because, so I had a TIA in August 2020, and then I had a couple of tests after then, and then I had a series of appointments with healthcare professionals at within my GP practice. And because I knew something wasn't quite right, and I wasn't really getting the answers or any answers, and I felt quite sort of dismissed, really, if I'm honest. So I took matters into my own hands, and I went on Google and I bought blood sugar testing kits. I bought urine testing kits. I bought, so I was testing my blood pressure. I was testing everything, putting it all in a chart, just trying to work out what was going on, because I knew that I just wasn't right. I was lacking in energy. I was running at this time, and I just couldn't
Tell us what sort of athlete you were.
So I was running about sort of 2 or 3 10Ks a week. So literally the week before I had the TIA, I had done 3 10Ks that week. So I was running at quite a decent rate at that.
Because I think that's
time.
really important that we tell people that it affects all generations.
Mm-hmm.
And although the prevalence is probably higher in people with cardiovascular like cardiovascular diseases that contribute to heart failure, you were.
I was running quite a bit.
You were really fit, weren't you?
But it was my running in bizarrely that was the thing that I was realising that something wasn't right. Mm-hmm. I was having what I thought were panic attacks when I was running uphill. I couldn't get my breath. And even though I was, with my friend trying to calm me down and and reassure me, I just couldn't get my breath. So anyway, about a year after my TIA, I had a big dizzy, breathlessness, fatigue, and ended up at A&E is a quick version. Had more tests then. So I had the Holter, the 24-hour ECG Holter, and then an echo.
Holter monitor,
mm-hmm. Yeah, sorry. And then a couple of months after then, I then had a conversation with an outpatients with a cardiologist, and although he did say that I had that it was to do with my heart, all of what was going on, mm-hmm. I didn't leave that appointment really understanding that I had heart failure, and it wasn't until a few months after that
So how did that make you feel then?
Well, I just didn't understand. I didn't understand any of it, and I kept thinking, it's nothing, it's no big deal. I remember leaving that appointment with the outpatients, and I went off and bought some flip flops because I needed them for the holiday. That's how important or not important I thought that appointment was. There was no moment as such where anyone, I felt, sat me down and said, "This is what it is. And this is how we're going to treat it. This is the medication, and this is how it might look going forward."
So how many appointments did it take before heart failure was considered? Or you were told?
I don't feel that I fully understood that I had heart failure until December 2021, which is all that time after my TIA. That's when I finally understood that that's what was going on. And I then had an ICD fitted in the March following that December. But it took all that time. The other thing to add is that because of the work I'd done with Pumping Marvellous and the projects that I've been involved with, I decided I would look back over my GP records and look back to see if I'd had an NT-proBNP, because I was interested what my number was back then. And I couldn't find any record of that. What I did find were my echo results. And it turned out I'd had an echo back after the after the initial TIA, mm-hmm, I'd had an echo then. Mm-hmm. And it turned out, actually, I was diagnosed then, and that was lost, and that disappeared, filtered somewhere. I never knew that. So all the time I was talking to my GP practice about my symptoms, that was sat there on my records. And
so how many times do you think it took to get you to that point where they actually gave you the right stuff?
I'd say about 14 months for me to get on the right place.
Wow.
Yeah. And so by then I'd had about 3 echoes.
So we've got 2. I'll let you breathe, Corinne.
Yep.
I know you very well. I know, but we have 2 polar opposite diagnosis, really. I mean, the diagnosis of heart failure is not great anyway, but from Gavin's story to Corinne's story just shows the differences. And Sue, why can heart failure be so difficult to recognise I know you do 15-minute consultations, or not your consultations, but
everyone gets an NT-proBNP that I see. In
a 10-minute consultation, why is it so difficult to think of it?
Yeah, I mean, I think, it's down to that clinical index of suspicion or lack of it, having that clinical curiosity about the person that's in front of you to explore their symptoms effectively. And having that knowledge and understanding in the first place to do the right test. But, patients, people don't always express those symptoms. They come about something else. They come about often the trivial things and mention the important things at the end or not at all. So that can make it really, really difficult. And the time is pressured, of course, in a GP appointment, many of whom only have 10-minute appointments. And the symptoms are vague. So cough, I think, is a common one that goes under the radar. Very easy to dismiss as it's a viral infection, it's a chest infection, it's any
Something
one of a
else.
number of things. But cough often goes under the radar. I think if somebody comes with big swollen legs, a clinician's possibly more likely to think of it.
And it's strange because I never had the swelling. My swelling was in my abdomen, and that was the fluid overload that was causing the cough.
Yeah. And I've seen people presenting with ascites. I certainly remember a lady who was admitted 3 times in a year before I saw her with ascites.
Ascites is?
Oh, sorry. It's fluid in the tummy.
Okay. Yeah.
And this...
Sorry, I was just...
I beg your pardon. Yeah, of course. This particular lady was very, very overweight. So I think her body mass index was, probably approaching 50. So she was difficult to examine and difficult probably, I guess, for the hospital to investigate. So I guess I'm making some excuses there, but she had abdominal discomfort, so tummy pains because of the fluid. So she was admitted under a surgical ward. Surgical doctors don't think about heart failure. So she had a CT scan of her tummy. She couldn't fit in an MRI scan. Tests were suboptimal. So by the time I saw her, she just thought she was fat. And that was the cause of her symptoms.
Obese.
So she actually came to see me because she wanted to lose weight to sort her symptoms out. And I said, hang on, I think there might be something more here. She was actually only about 45, I think, at the time. So those sort of symptoms, it's very easy for them to be dismissed because they're vague and can easily be put down to something else.
And this is why if patients know the beat, then I think that helps because then if I feel that if I'd known the beat symptoms, I actually would have been a bit like, when I had the TIA, I knew exactly what was going on. The fast was I knew exactly. If I'd known the beat, I would have been, hang on a minute, I'm breathless at this point. I'm so tired, and I could have gone with that question. Yeah.
And people, particularly this lady who's very, very overweight, wasn't really used to doing any exercise or moving about at all. So breathlessness didn't really feature on her radar.
Yeah.
Because she didn't really do very much. Yeah. So somebody like yourself who was exercising an awful lot, it then becomes immediately apparent when you can't. So, a lot of our patients with heart failure have got multiple health conditions or are much older and frailer. So those less, the vague symptoms are very easy for people to put down to something else.
So would you say breathlessness is the key, often misdiagnosed, misattributed, most dismissed because it's respiratory, because you think in lungs?
I think cough is probably the commonest dismissed. I think cellulitis, so skin infection in the lower legs in people who have got some edema, that also goes under the radar. I think what's the commonest symptom that's missed? Probably fatigue.
Is that because of the breathlessness?
So I think people in the early days with their heart failure symptoms commonly have fatigue. And a lot of people with fatigue and sleep, lack of sleep in our population is a pandemic on its own, isn't it? So people do feel tired.
Well, a lot of my sleeping issues were the fact that I had the fluid, and if I laid down, I felt like I was drowning.
Yeah.
And that was the thing. So if somebody comes along and they mention that they're having to sit a bit more propped up, or they can only sleep comfortable when they're sat in a chair, then again, that should be a red flag, shouldn't it?
Absolutely.
Something that's going on. I mean, I said that I was coughing, I was struggling to walk upstairs. I did a lot of work with young people. So I'd be walking along with young people, and I'd be huffing and puffing. And if I was on the phone to anybody, they were trying to send me a message, or I rang them back or whatever. They thought I was jogging while I was talking to them. And that breathlessness, that exhaustion is all combined. And I think, like Corinne was saying, the BEAT acronym, if people could spot those signs and symptoms and start to put them together and think, hang on a second, they're the heart failure symptoms and signs and symptoms.
Yeah, and also know the related things that can cause it. So the TIA for me was related to my heart. It was a blood clot that split. So therefore, if it's making those links as well, isn't it? So it's you've had a virus, but now you're breathless, and now you're fatigued. It's making those links as well, isn't it? So to put them together. And as patients or as people, knowing sort of those kind of links and more awareness.
Can I ask a question?
Yeah.
Corinne?
Take the mic.
Going back to your time of your TIA, what happened in the stroke assessment unit in terms of looking at the cause for that TIA?
I had an echo and the 24-hour ECG, the Holter monitor, and that was it. And I had a telephone conversation following it, and that was really the end of that.
Did you feel that was an opportunity that could have triggered?
Well, you can imagine it was extremely scary at the time,
Yeah,
and I had no understanding of why. It was an ambulance situation and taken to A&E, and because of the times I was there by myself because of the COVID restrictions, and I left at 3 a.m, none the wiser, and and hence why my level of anxiety then was high, and it was. You just come away with sort of, okay, right, got to move on then.
So when you actually were told it could be your heart, or it could be heart failure, or whatever, however it was dialed into you, how quickly did you get the tests after that?
Go on, you go
either of you.
Right, yeah. So my GP started some of the tests. He requested an echo, and we just got the results back. That day when I had a really bad session. I was downstairs with family, and I said, I need to go to bed. I'm exhausted. It took me 3 tries to get up the stairs. I got up the stairs, got to bed, set all the pillars up as high as I could, got the thing. And even at that level, I just couldn't breathe. So I had to text my wife downstairs and say, look, I can't cope, So she rang an ambulance. I went to A&E, spent several hours in A&E, and then they looked. I'd taken the echo, we printed off the echo results because I'd seen them coming on my record. And the cardiologist that came to see me, I don't know what level he was, but he came to see me and he said, oh, you've got severe heart failure. At that time, I was being treated under Manchester. I live in Lancashire, so it was in a local hospital in Lancashire. And he said, do you want to continue treatments under us, or do you want to continue with Manchester? And I said, well, I'd probably go back to Manchester because it's a specialist heart centre. It's where my ICD's monitored, etc. And he said, well, when you go there, you need to start talking about transplants. And then he said, any questions? I've got to go now. And walked out the room.
Eek.
And then, so I spent a few days in hospital then trying to pick up what was going on.
You'll never forget that, will you?
No, it was just like the ground opening up. My wife was in there, she ran out in tears. And it was just, it's a challenging thing. But then the tests came much quicker after that. But it was that shocking diagnosis delivery was really bad. I
had a similar, I was diagnosed in the same hospital you went to in Lancashire. And I remember lying there gasping for breath and I couldn't breathe. And unless you've experienced that level of breathlessness and that level of panic, I don't think you can describe it enough. I don't want to go back there again. A doctor, the nurses, I remember they were like animated characters. That's all I saw, like whacking leads on and putting tubes up the nose and God knows what. And the doctor came along, and I think he was like a house doctor or something, and said, "You've got heart failure," and walked off.
Yeah.
The impact on me was, actually, really? Have I? Okay, what's that about? My mother and father walked down the corridor, and my mum was nearly collapsing because I saw my dad, and I saw right down the corridor because my bed was. I didn't want to go in like I like the conversation and chat with other people, so enough. That I remember. That I remember because there was no emotion to such a dire diagnosis of somebody who's 39.
Yeah.
And it was the first time our family had to deal with, apart from grandparents, but the first time our family had to deal with anything like that before. And hopefully we don't have to deal with that too many times in the future.
Traumatic. Absolutely.
So, Corinne,
traumatic.
what was?
Yeah, I mean, as you're talking, I mean, I don't remember a specific moment where there was that sort of that you have got heart failure.
Eureka.
It was more sort of right. Well, now we're going to do this, and that'll the next thing that's going to happen is that, and lots of testing. I mean, within the space of probably about 6 weeks, I had an MRI, an angiogram, an echo, a bubble echo, a CT scan. I felt, I mean, I started calling them my spa days because it was another time in a dressing gown and going for a cup of tea and a biscuit. It was literally, they were coming that thick and fast. So in that respect, I was extremely well looked after. And I felt very thoroughly checked over because they couldn't really understand how I'd got to this, the situation I was in. But it almost got to the point where, because there wasn't an actual moment, the moment, if you like, was when I went for my ICD, and that was the moment when the sort of the family and the friends focused on, and me, I suppose, was because that was the event. Whereas there wasn't really a sit down at a desk and, right, we've got all your results back and this is how it is. It just, because of numerous reasons, it didn't pan out that way for me. So it was like a drip feed of information over a very long period of time, really. I think the impact really is that you don't have and I still do now to an extent, a sort of a disbelief that it actually even happened or has happened, or that I have got heart failure sometimes. And I still struggle some days and thinking...
It's like PTSD, isn't it? Traumatic stress syndrome.
Yeah. And the days where you're actually fine, you're like, oh, I've just made this all up and they've made a mistake. You sort of, you go around that because it's very difficult to get your head around.
So this program of works that we're doing, this masterclass, marvellous masterclass in training a very broad spectrum of non-specialists in heart failure in the northwest of England. How do you think that will improve confidence in requesting NT-proBNP and the management of patients when they come out of the specialist MDT multidisciplinary team?
Yeah, I mean, I think it's got to help, hasn't it? It's getting that education disseminated beyond that relatively small audience as a proportion of the whole of our workforce. But having that confidence to articulate that clinical concern to somebody that they might have heart failure, to be able to explain what it is in an effective, appropriate manner, I think is so important right from the word go. I think I'm really sad to hear how somebody could be told they've got heart failure in the way that you have. It's just, I don't know why I'm finding it so unbelievable, because I know it happens. I used to run a community heart failure clinic for some years, and I used to take patients who just had a hospital admission for early optimisation of treatment. And some of those patients didn't know they had heart failure. And they said on the letter to patients, this is an appointment for a heart failure clinic, and they didn't want to come because clearly they didn't have that diagnosis. So I think we really do need to empower clinicians to be able to articulate what heart failure is, so that, I mean, it's always going to create fear, isn't it? Yeah. But to be able to articulate it in a way that the clinician isn't scared of it because they understand it and then they know there's some treatment for it, to be able to allay some of these anxieties. And actually anxiety in heart failure, it's really important to manage that.
It's rife.
Anxiety drives adrenaline, which makes heart failure worse. And obviously with the breathlessness you describe, which is obviously horrendous, you feel like you're being suffocated. You can get disordered breathing down to anxiety. So you don't want disordered breathing on top of fluid overload. So I'm hoping the education can start to instill some confidence and competence to request the right tests early and to articulate that diagnosis or suspicion of diagnosis in an effective way.
I may be wrong here, but aren't you trained as doctors to understand emotions, but to take out the emotions in a consultation? Because doesn't education change the emotional tone?
Absolutely.
Of consultations. So are we trying to retrain what you've been taught?
So consultation,
or is that dangerous?
Yeah. I mean, I think there's a few elements to it. It's very hard to be confident if you don't understand a clinical situation. And then there's a human nature approach to that you will avoid it, won't you, even as a doctor. In terms of training in communication skills, GPs actually are probably the only ones that have mandatory communication skills in
Not
their
that word mandatory.
In their they do actually in their training years. They don't have it once they're a GP, but certainly in the way medical education is set up now for GPs, they have to have communication skills training. It isn't in any other specialty in the NHS. And that's why you can often see a bit of a disparity in terms of how specialists might articulate things. But I go back to, if a clinician isn't confident and competent in the management of a diagnosis, they might not be able to articulate it in a
huge
humane way.
And wouldn't it, if you aren't sure what you're diagnosing, you've got suspicions, I think knowing what next steps are, both as a clinician and as a patient, would be helpful and would help reduce some of that anxiety for both parties and allow that thing. So if when I went in and they said, right, okay, the next thing we need to do is a group of tests and it's going to take 3 to 4 weeks, but don't worry, because as we get through those tests, we'll be able to deal with things. But there are some initial medications that we might be able to put on. I'm going to refer to a senior colleague within the practice next week, and you can come and see them. So I think if people had a knowledge of what it was, and if they weren't clearly able to diagnose this, but they knew what the next steps were. So you said to some of your junior partners or nurses and said, look, if you suspect this is happening, this is what I want you to do. I want you to communicate that to this person, and then they might be able to assist. Would that make sense?
Yeah, and that's down to service delivery and redesign, isn't it? Which I absolutely believe has to happen. But just coming back to the fact that heart failure touches all sectors of the NHS, and as you've experienced, the articulation of that diagnosis needs to improve right across those sectors.
So knowledge in heart failure just doesn't change outcomes; it changes the atmosphere.
Yeah,
it does.
So, all right, what needs to happen next? All right, Corinne. What would you say to every non-generalist? So we're not going down GP nurse here. Yeah. Because I think it's fair to say that it's a lot bigger than that. What would you say to just one thing that you say to that they had to learn from after listening to this podcast? What would you say the generalist needs to know?
To understand the beat symptoms and to
which
are breathlessness, exhaustion, ankle swelling, time for an NT-proBNP, or further investigation depending on the setting, and look at the symptoms, not necessarily the person that's in front of you or the collection of symptoms.
Gav?
Yeah, and once you recognise those, share your concerns. Don't keep it to yourself. Don't think, because that's a missed opportunity where that diagnosis could have happened sooner.
Sue?
Develop an ability to articulate what heart failure is effectively.
Okay. So we talk about heart failure as a system challenge, but sometimes it's much simpler than that. I'm not saying it's simple, but it can be simple. Sometimes we do overcomplicate things, I think. It's about whether the person across the desk recognises what's happening to you. And education shouldn't be optional. This is why we hope these masterclasses will grow some legs and lots of different formats and how we choose to communicate them. Because behind every delayed diagnosis is a person waiting to be understood. And when primary care understands, or generalist understands, heart failure, patients don't just get treated sooner, they feel safer, seen, and supported. And on that note, we'll say goodbye. Thank you.